The Indiana Department of Health approved boosters for Hoosiers 12 to 15 years old this week. The move comes after the state reported a single-day record 15,277 new cases Thursday, bringing the total number of positive cases to more than 1.3 million. Monroe County set a single-day record Wednesday with 297 new cases, and the county's 7-day positivity rate has climbed to almost 19%.
These numbers moved our advisory to a 2.5, which is still orange, but we are quite likely on the road to being red.
More than 3,000 Hoosiers remain hospitalized with the virus, the most in more than a year. The state has added 150 new deaths Thursday, bringing the state total to just under 19,000. We're joined now by Dr. Paul Calkins, the interim chief medical officer for IU Health South Central Region. Welcome to the show, Dr. Calkins. You know, as we just heard, more than 3,000 Hoosiers hospitalized in the state with COVID-19. You know, we hear these numbers, but we don't see it. How much stress is that putting on the healthcare system?
Well, it's putting a tremendous amount of stress on the healthcare system, actually. And just so you know, IU Health's top 600 inpatients for the first time ever in the pandemic today. It's just extremely intense right now. I believe we're 5 waves into this pandemic, depending on how you count, and people are exhausted. It's really becoming kind of more than you can take to just have this surge after surge after surge. And I think the other thing you need to recognize is that we have certainly thousands of people who have delayed surgery because of the pressure on the hospitals, and many other people with other medical conditions that are having to wait because we just don't have the capacity to take care of them. So once we finally get through COVID, we have a whole nother population of people we need to take care of.
You know, the majority of the cases we hear are the Delta variant, but Omicron rapidly on the rise. We hear it's more transmissible. What kinds of challenges does that pose?
So I think we should assume that Omicron is rapidly becoming dominant. The state published some new variant information, and they were calling 50% of their sequence variants Omicron as of the 10th or the 20th of December, so the week before Christmas. So at the rate that that's growing, I think we have to assume that Omicron has become really pretty dominant in Indiana. Apparently it is less likely to cause hospitalization, but there's just so much disease that we're very worried that we are not going to see any relief in the hospitals from Omicron.
Riley Children's Hospital said admissions of children is 4 times higher than at any point in the pandemic. Are you seeing those numbers at IU Health?
So in the hospitals here down in the southern part of the state, we generally would not keep children with COVID. If they needed to be hospitalized, we would transfer them to Riley. So our patients tend to be young, middle age, up into the elderly population. I will say that the 0 to 19 patient demographic is actually the highest number of COVID cases that are recorded in Indiana. And with the numbers being as high as they are, it's not surprising that the number of hospitalizations has gone up. It is fairly striking at Riley right now.
Doctor, thank you so much for your time. We know you're busy, so we appreciate having you here today.
Thanks for having me on.